Australia recently reformed its regulation of the childcare sector, but is there any evidence of benefit for these reforms? The new national system was introduced on the 1st of January 2012. The National Quality Agenda is aimed at increasing the quality of childcare services through stricter minimum standards and a more rigorous quality assessment process. Under the new requirements, staff are legally obliged to supervise a smaller number of children, and they must have more formal qualifications than under the old system. This pushes up the price of childcare and costs families and taxpayers. The government and childcare advocates argue that these costs are worthwhile because the reforms will increase the quality of childcare, and higher quality childcare is beneficial to all children. These benefits, they argue, outweigh the costs. But how accurate are these claims? A review of Australian and overseas literature on staff-to-child ratios and staff qualifications suggests that improvements in these areas do not necessarily lead to better outcomes for children. The evidence suggests that the benefits, where they do exist, are small. Australian research indicates that lower staff-to-child ratios do improve children's behavioural outcomes, but neither lower ratios nor more qualified staff have an impact on their cognitive outcomes. What about the costs? The government did commission modelling to estimate how much the reforms would cost, but several key areas were ignored. How the reforms might impact the supply of childcare places and the ability of both parents to work were not modelled. This is in spite of the fact that these issues greatly affect families. These reforms have been sold as an investment, one that generates returns to society. But if the benefits are unclear and the costs have been underestimated, then these reforms do not represent value for money, and they are not an investment. To find out more, download the report Regulating for Quality in Childcare, the Evidence Base, from our website cis.org.au.